So they created a red herring. A red herring is a distraction. They decided that they would pick a fight on health care. Well, let me look right into the camera and tell you very clearly. Republicans are the ones concerned about health care. Republicans are the party working around the clock every day to fix health care. This is not talking points for us. We've done it. A big part of the One Big Beautiful Bill, the Working Families Tax Cut, was to fix health care. Healthcare is broken in America. It's too expensive. The quality of care needs to rise. We need more access for more people, and we have lots of ideas to do that. But that issue is for debate in the next 3 months. It always was. We have members working on that.
Hi, my name is Dr. Rubin, and I don't quite understand because the big, beautiful bill doesn't actually fix healthcare. It just causes more cuts, close to $1 trillion to Medicaid, as an example, that'll happen over several years. And there will be work requirements put in place that may sound reasonable on the surface, but we've seen in reality that this does not end up working. We saw that in Arkansas, where tens of thousands of people lost their health insurance because of red tape that's involved with work requirements. This is not a matter of trying to address waste, fraud, and abuse and actually changing the way that we deliver healthcare and also the social determinants of health that help improve upon the health and well-being of Americans as a whole. There are many different reforms that could be put in place but aren't actually being addressed, like addressing prior authorization reform to pharmacy benefit managers that end up jacking up the costs of different prescription medications, evening the playing field to have primary care get specific benefits for practicing good primary care. We've seen over 33% cuts to Medicare reimbursements for physicians since about 2000. And so there's really not much incentive for medical students to go out and specialize into primary care because of the amount of debt they have to accrue and pay off over time. So this is a complicated issue that by cutting things is not necessarily going to fix it. The actual real reforms aren't even being addressed. And what needs to happen is we need to have an expansion of social safety nets in order to not only improve the health and well-being of those who need it, but it also will impact those who are on private insurance, because all of these cuts will end up being passed on to everybody else, especially with the Affordable Care Act subsidies being cut as they expire very shortly. So we're going to all see our premiums go up very quickly.